Hello. Well, here we are. Operation Day at last. How are you feeling? Not too bad. It's a tricky question because nobody looks forward to having an operation. However, it is necessary and you will feel much better afterwards. So, here's what's going to happen. I've got a quick questionnaire to go through with you just to check everything is absolutely fine and we can go ahead. Then what I'll need to do is take your pulse quickly and your blood pressure. Okay. Then what we'll do when it's time is we will take you down to the operating theatre and I'll be there with you as well. And that is where we will pop you to sleep. And then you won't even know about the next part. But I will also be there while you're asleep, and then finally I'll be there when you wake up. How does that sound? Great. Okay, so we'll get the lengthy bit out of the way first. Quick questionnaire, just a few questions about your general health, which will just finish the picture off for me, just to make sure there aren't going to be any problems today. Is that okay? Great. Let me grab my list. Okay, here we go. So, just answer with anything and everything you can think of. You'll hear me scribbling away. I'll ask for any more information if I need it. Okay? Great. So, let's start with anaesthetic. Have you previously had anaesthetic before? And if so, what for? Okay. And did you have any previous problems with the anaesthetic? Any family history of problems with anaesthetic? Okay. Do you have any allergies? And if so, what to? Okay. So when you get allergies, what type of reaction do you have? Okay. Specifically, are you allergic to penicillin? Okay. And are you allergic to any anti-inflammatories? Right. So now think about any regular medications that you take and tell me about those. Pain relief for your current problem? Okay. So, when did you last take any medication outside of what you've been given since you got here? Okay. And you're not taking any anticoagulants, antiplatelets, anything like that? So you're up to date with all the medication that you've had since you got here, is that right? Great. I see the nurses have done a very good job in popping that cannula in already, so that's one less job to do. So you can essentially sit back and relax now and let all these specialists do their jobs. Okay. Back to regular medications. Do you take any herbal medications? Any over-the-counter sort of herbal remedies, medications, things like that? Okay, good. So, tell me now, what's led you here? Tell me what you're having surgery for today and why it's necessary. It will sound very obvious to you, but I need to know that you understand. Okay, yep. Did it take lots of tests, lots of diagnosing? Mm-hmm. Okay, good. We're about halfway there. So, moving on. Excuse me while I shuffle my papers. We're just going to look briefly at your past medical history. So, thinking about your respiratory system first. Anything I need to know. So, do you have asthma? Are you asthmatic? Are you a smoker? Anything that might affect those lungs at all? Okay. And any heart problems, anything like that? Palpitations, anything? And how is your stomach? Do you get indigestion, heartburn, anything like that regularly? Mm-hmm. Now tell me, and be honest, how often do you exercise? Mm-hmm. Okay. And how often do you play sport? Things like that? And aside from your current problem, have you recently been admitted to hospital for anything else? Okay, so a couple more questions and then a quick examination of you, okay? So, have you had anything to eat or any milk to drink in the last 6 hours? Good. And have you had anything to drink in the last 2 hours? Excellent. Have you made the nurses or anybody else aware of any medication that you're going to need after the operation so we can work out what it is you need to take and how much if we need to change that medication at all based on what's happened in the op? And finally, the final question and the most important question. Do you understand what's going to happen today? And do we have your consent to not only operate, but to give you this general anaesthetic to send you off to sleep? Fantastic. Okay, great. So, the first thing I'm going to look at before I do your pulse and your blood pressure is I'd just like to look around your mouth and throat, if that's okay. Just to check for airways and things like that, to make sure everything's going to be perfectly fine for you. So I'll pop this clipboard down. And I'm going to pop on some gloves, okay? How long have you been waiting for your operation? Not too long? I think you've met lots of different health professionals today, have you? And we're working very, very hard right now. Okay, fantastic. So we're going to take these things one at a time. Then you'll just hear me ticking them off on the clipboard. Okay, fantastic. So, firstly, can you open your mouth nice and wide for me? I don't need to touch. I'm looking at how wide you can open your mouth. Thank you. Now, I'd just like to touch your jaw, if that's okay. Okay, ready? Fantastic, thank you. Now, could you please move your head for me? Side to side, up and down, all around. I'm looking for how well your neck can move. Don't do anything uncomfortable or anything painful. I'm just looking for that motion in your neck. That's great, thank you. And now I'd like to have a quick look in your mouth, if that's okay. What I'm going to do is shine a light in there, so I can just take a look around your mouth and into the back of your mouth, okay? Great, so open nice and wide for me. Lovely. That's it, thank you. And then finally, tell me about your teeth. Do you have any false teeth, any crowns, any teeth that are loose, anything that might cause a problem? Okay. Excellent. That's that part done. So, next, I'd just like to take your pulse, if that's okay. So, what we'll do is we'll use the arm that doesn't have the cannula in, okay, because that will be more comfortable, and we'll also use that arm for blood pressure as well, because you don't really want to be taking blood pressure in the same arm where there's a needle, but a cannula. Okay, so all I'm going to do is feel your pulse, count for a little minute, just check everything's okay. So, which arm? This one? Okay, thank you. So, are you ready? Okay, here we go. Very nice. That sounds good to me. Let's make a note of those numbers. We can compare them later. Okay. And then finally, blood pressure. I would imagine you've had your blood pressure done several times since you got here, is that right? Okay. Well, just once more for me. So, same as before. This will go over your arm. Then you'll hear the machine, and then we'll take it back off. Okay, so same arm. You ready? Open it. it will be a little tight. Okay. Are you ready? Let's push the button. They are noisy machines, but necessary. Okay. Lovely. Thank you. Take this off. Slip your arm out. There we go. Lovely. I'll just make a note of those numbers. Great. So, finally, do you have any questions for me? I know that you've had lots of appointments, lots of pre-op assessments, you've seen surgeons and doctors and nurses, and now an anaesthetist. But is there anything that you'd like to know? Is there anything that you're worried about that I can help with? It's very normal to be nervous, absolutely. However, you're in very good hands today. We have a fantastic team, and all I can do is assure you that there really is nothing to worry about. It's best to try and stay as calm as possible. But if at any point along the way you have any questions, or there's something you need the answer to, then please just shout any of us, and we'll be able to help you. Okay? Great. Okay, so it shouldn't be too much longer now. So I will leave you in the capable hands of these fantastic nurses, and I will see you soon down in the operating theatre. Okay? I'll see you shortly. Hello again. So, operation time. Are you ready? Okay, good. So, as I said earlier, I will be here to administer your anaesthetic, and then I will stay throughout the operation, and I will be there at the end when you wake up. Okay? Good. Any more questions for me? Okay. So, here's the most important part. The best thing you can do right now is your very best to relax. Okay? Lovely. So, what we're going to do is we're going to pop this anaesthetic in to the cannula. It will feel very cold going up your arm, okay? A very odd sensation, but it's completely normal and it will pass, okay? And then once we've popped that into the cannula, we've got some oxygen here, and that's just going to go over your mouth, and that will help you to just drift off. What we'll do when the oxygen mask goes over your face is we'll count down from 10 together. And the next thing you'll know, it'll all be finished and you'll be waking up. Operation over. Okay? Great. So, while we do this, a few deep breaths would be lovely. Okay? So all this is at the anaesthetic. Okay? And it's going to go into that cannula. Okay? Right. Here we go. You ready? Great. Take 2 seconds. There we go. How's that feeling? Cold? Excellent. Okay. I'll be getting to work really soon. Okay? Fantastic. So, oxygen mask next. I'm going to take some lovely deep breaths. Are you ready? Okay. Here we go. So, some nice deep breaths. Deep breath in for me. And out. Deep breath in. And out. Deep breath in. And out. Well done. Now, it's time to count back from 10 together. Are you ready? Okay, here we go. 10, 9, 8, 7, 6, 'Hello there. How are you? Wakey, wakey. Can you hear me? Don't worry too much. If it's blurry and fuzzy right now, it will all come back. The important thing right now is to just keep waking up. I'm very pleased to tell you that your surgery went very, very well. The surgeon will pop back to see you later, but they are very, very pleased with how it went. So you can now concentrate on getting better. That is your job for now, to get better. How are you feeling? Can you tell me how you're feeling? Are you tired? There will be plenty of time to sleep once you're out of recovery and back onto the hospital ward. But for now, if you could just wake up a little bit more for us, just to make sure you're okay, that you're feeling okay, that would be great. Do you know where you are? That's right. Do you remember who I am? That's close enough, actually. How are you feeling from the surgery? How is your pain? Do you need more pain relief? Good. You shouldn't be feeling an awful lot of pain at all at the moment, because you were given some pain relief before you woke up. But if you do need anything else, ask any of us, okay? And we can get that sorted. Super. Hello. Feeling good? Feeling as good as you can? Lovely. Right. What's going to happen now is you're going to go back down to the ward, where there will be lots of lovely people to look after you. The surgeon will be down later to see how things are going. The nurses will be there, the doctors will be there to see you later, to check how everything is. And if you need to see me again, just ask. But for now, take very, very good care of yourself and get well. Take care.